My name is Xiomara Cabrera, Inglés técnico, teacher Dr. Moscoso. Talk about is the cancer-associated mutation in endometriosis without cancer. Concept. Endometriosis is a benign disease consisting of the presence of endometrium without the uterine cavity. Endometriosis is an important cause of the infertility. So of the 40% of women with endometriosis will not be able to get pregnant. Talk about is the video.
Disorder of the female reproductive system. The uterus plays an important role. Each month, during a woman's menstrual cycle, the endometrium, the inner layer of the uterus, grows and thickens to prepare for implantation of a fertilized egg. Then, an egg is released from the ovaries and travels to the endometrium. If the egg is not fertilized, the endometrium sheds as a normal part of the menstrual cycle. This is commonly known as the period. In girls and women with endometriosis, some of this endometrial tissue does not exit the body during menstruation. Instead, it becomes attached to organs surrounding the uterus, such as the fallopian tubes.
Talk about is the application in nursing. Control of vital signs, control of presence of vaginal discharge and characteristic, control of the appearance of aggravated symptoms such as fever, pain, health, education, support, and counseling, work on the coping of the disease and the coding about this disease of considering the most sensitive point that the woman can find. Assisting in relation techniques by managed in analgesic treatment such as paracetamol of the wide prescription. Talk about is the video.
In which the endometrium, or the tissue that normally grows on the inside of your uterus, instead grows on the outside of your uterus, creating endometrial implants. Dr. Edwin Ramirez at St. John's Regional Medical Center explains the symptoms.
One of them is pelvic pain during intercourse. The other thing is premenstrual cramps, which patients can think of being normal, but usually they happen 3 to 5 days prior to the menstrual cycles. They can be debilitating, sharp, radiating pain, mainly located in the pelvis. However, it can happen independently throughout the body. Other symptoms are heavy abnormal bleeding that occurs within the first 5 to 7 days of the menstrual cycle. That could be the only symptom of endometriosis. And lastly, infertility.
Fortunately, there are a variety of treatments such as medications, birth control, hormones, and minimally invasive procedures.
Talk about is the advantages and disadvantages. Advantages. The endometriosis diet is invariably very effective, not only eliminating the disease, but reducing the symptoms, help in reducing pain, prevents levels of estrogen, scaling, and hair-length hormones. Symptoms of pain and the groups are eliminated. Disadvantages. To get right endometriosis following a proper diet is not enough because you have to consult a gynecologist to support the medication complement. Endometriosis is a painful disease that can cause these groups do consent and create a lot of complications when it is not detected. In complication cases not only depend on a balanced diet or medication, you must undergo surgery. Talk about is the video.
Health disorder affecting women, and painful periods are its primary symptom. Painful cramps before and during menstruation, sometimes specifically in the lower abdomen, is another symptom of this condition. Extreme pain during or following sexual intercourse or bowel movements. It well. Drink this twice a day. You will need a bark of Ashoka tree. It is commonly available in Ayurvedic stores. Crush it to get about 2 tablespoons of powder. Mix it in 250 ml of water. Heat till only half the liquid is left. Strain the liquid. Drink this liquid 2 times a day. Take flax seeds.
Is why I play in Ecuador. Endometriosis is the second most important gynecological disease and the first between 7 and 15% of a woman in reproductive life. There are roughly Millions affected in the world as noted by gynecologists Victoria Velasco, director of the Center of Study of Fertility at Santa Monica Hospital. Talk about is the video.
Please allow me to introduce her skills and expertise. Among all gynecology surgeons in the world, only 2% are qualified and formally trained to perform advanced minimal access surgery. And Dr. Selma is one of these 2%. It is an honor for me to announce that Dr. Selma is the author of the Standards for Laparoscopic Surgery, commissioned and published by the Royal College of Obstetricians and Gynecologists, UK.
And finally is conclusion. Endometriosis is a benign disease that causes infertility in women by creating a mass outside the uterine cavity, in which the must follow guidance due to several health from clinical diagnosis. Since the process is slightly complex, that there is often confusion in the initial treatment of the patient, in which they must have effectiveness in the different medical and surgical approach of the disease in order to provide a favorable result of site pathology. Talk about is the video.
Endometriosis.
Doctor, like in this, the period pain is there, but as well as there is pre-period pain, like 3 to 4 days prior to the period, the pain starts and it lasts for all the time throughout the period.
Okay.
And with every period it worsens. Like if she's saying 6 months back I used to have pain for 2 days, but now it will be for 5 days. Yeah. And besides this, there's dull aching pain in some of them throughout the month. Pain during defecation, pain during urination, depending on the position of the endometriosis. And the worst thing is infertility. It is seen in 50% of the females that with endometriosis there is correlation with infertility. Ultrasound.
Thank you.